Literally, we are still negotiating final language. I'm in and out of these talks and just finished a call. We are actually negotiating as much telephonically as we are in person, given the constraints that we have to observe. And so let me just begin by thanking everybody who's on the call, the leadership who brought us together today. And I am happy to, first of all, give you a brief summary. But as you know, I have been talking to people all around the state, largely by conference call, by teleconference call, by individual calls to healthcare leaders, hospitals, healthcare centers, docs, and small business leaders. I've had actually a few in-person meetings before I came down, seeing how businesses are struggling. I don't need to tell anyone on this call, but I just want you to know, I understand how everybody has been crushed, literally crushed. Workers have been crushed by layoffs and furloughs. Families are struggling to put food on the table, literally pay rent and mortgage. Small businesses are going through the excruciating pain of laying people off, which hurts you, I know, emotionally as well as economically. And so we have felt the urgency of this moment. We are not here kind of laying back. Literally, we've been working nonstop into the early morning hours, and the goal has been to get it right as well as get it done quickly. The total package is in the range of $2 trillion. That's about as much, a little bit more than most federal budgets, which we take months to approve, literally with hearings and meetings and fly-specking the numbers and the wording. So this has been a crunch of the highest order. And I think we've made enormous improvements in the last 5 days as we head to a vote, probably this afternoon. As I mentioned, some of the documents still hasn't been written, which of course, as you all know, as business people, once you actually start putting words on paper, sometimes there's some issues that you didn't discover earlier. But we're all hopeful we can get to a vote this afternoon. And let me describe the broad outlines of this bill. First of all, for me, and I'm just going to speak personally, as much as I've seen the economic struggle, I've also seen the healthcare struggle. Fairfield County, where I live, has more than half the cases. Connecticut is on the border of New York, which is the epicenter now for the coronavirus for the United States of America. New York is literally at the tip of the spear here, and we are neighboring. We're going to see the cases surge here. We're going to see a need for ventilators, tests, masks, ICU beds. Again, you're all very well informed, but I just want to emphasize this point because one of the terms we insisted on being in this bill was a Marshall Plan surge on healthcare. A really massive historic commitment to those equipment, ventilators, masks, testing equipment. We have to know where the virus is so we know when people can go back to work, when kids can go back to school. They have to be tested. So this kind of equipment, medical care equipment, the first responders, the healthcare workers need to be protected with gear. 130 billion. It's 130 billion to all of our hospitals, healthcare centers, first responders, workers in the healthcare area. I can go into more details, but I want to sort of begin with that point because we won't solve the economic emergency if we don't solve the medical emergency. On small business, $367 billion. You know, the first two packages were respectively 8.3 billion and 100 billion, covering a vast variety of needs. This one is 350 billion for small business alone. Loans, which can be converted to grants. In other words, loans can be forgiven if the small businesses retain their employees. They keep people on payroll, the loans turn into grants. forgiveness, and also aid for nonprofits, which are vitally important to Connecticut, nonprofits that are kind of the backbone of our safety net, social safety net. They too are eligible. Small businesses are eligible as long as they're under 500 employees. There are separate programs for medium and larger size businesses, which involve grants, a combination of loan and grant programs with tax credits, $10,000 per worker if they keep those workers on their payroll. So these tax credits extended over years can be enormously beneficial. They're an incentive. Again, our goal here is to keep people at work. But for workers who are furloughed or laid off, and I emphasize furloughed as well as laid off, there is an unemployment compensation insurance system that is vastly expanded. So workers will receive close to full pay, if not full pay. If you work more than 100,000, if you're paid more than $100,000, you may not get full pay. But most workers will get full pay, which is different from the current system, for a total of 4 months, not weeks, 4 months. That is a major expansion, as you all know. And again, we want to put cash in people's pockets, workers, families, small businesses, get the cash out there, because this chasm of economic crisis is engulfing so many families as well as small businesses. We know what the struggle is, and time is not on our side. The SBA will be administering this money. It will go out in a matter of days, not weeks. The SBA will have expanded resources to make it available. Let me also deal with the another pillar of this program, which is the, I'm not sure quite how to characterize it, the bailout program. The bailout program is $500 billion, and it goes to those medium and larger businesses, also to airlines, as well as to some manufacturers. Boeing is included, because we recognize that some industries are especially hard hit. The hotel, tourist, airline industry, as you know, has been crushed. Hotels, I think, are at 10 or 20% of capacity. As you know, on the shoreline, and many of you in the New Haven Chamber of Commerce know about this problem, but it is a crisis that we need to address immediately. However, and I stress however, there will be oversight. There will be transparency. Within a few days, every deal will be made public. The original bill said within 6 months. 3 days is probably the time that it will be made public. So there'll be the sunlight of, which is the best disinfectant. I know, as Attorney General, by the way, I opposed the elements of the TARP program that later led to abuses. We're talking about taxpayer money here. This is not money that comes from the skies. It's your money, my money, our money, taxpayer money. So we need to be on guard against abuse, and there will be transparency. There's also an inspector general who can investigate, and there is a panel, a congressional panel, as did occur under TARP, to exercise oversight. So those are the major components of the plan, going to small business, nonprofits, and larger businesses. There is also, and here's what's really important for us in Connecticut, and we insisted on it, wasn't in the original bill, aid to state and local governments, $150 billion, a minimum of $1 billion to every state. But Connecticut should receive more because, again, we're at the epicenter or near to it. Our expenses are going to be bigger than other states. So it will go to state government, but also to local governments, those local public health departments, housing agencies, homeless shelters that are run by nonprofits or by local governments will all receive this money. State and local aid, very, very important. And there are other kinds of elements to this program. It's a uh, very lengthy, complex document. That's why it's taking a while to produce. And I would be happy to try to answer your questions. I'll try to answer all of them to the extent I'm able. The details have been overwhelming, and we've tried to do very quickly what normally takes months to do in just hours. And if I can't answer a certain question, we'll try to get back to you as we've done on previous calls. I've had teleconference calls with small businesses in Danbury through the Danbury Chamber of Commerce, the northwestern part of the state, southeastern part of the state, finished yesterday with the Southeastern Chamber of Commerce. But I really appreciate all of you. I know we have a lot of people on this call. I'll try to take as long as I can to answer your questions. But I guess I just finished by giving a shout out to the healthcare workers. You probably know many of them. They're on the job right now, caring for people. They're risking everything. They don't have many of them don't have all the equipment they need. Our first responders, our police, our fire, they're walking into situations where they don't know whether they'll be infected. And many of you I know have family. You're worried about your family, worried about your employees. Some of you still have doors open because you're essential services, and we're trying to help everyone in this really monumental crisis. Thank you.
Senator, we appreciate you being on, and we have over 240 people who are on the line, and then we're also on Facebook Live right now. So there's definitely been a lot of interest. As you mentioned, so many of our businesses are just getting devastated right now. This sounds like an incredibly huge safety net for businesses. I think the first question I'll ask is how do you see this being accessed? Because there's going to be a huge rush of businesses trying to access these programs. I guess probably you're going to need some patience, even though that's really difficult right now with what everyone's facing. But how do you see this being accessed and getting out to businesses?
Well, that's a great question. There are going to be, by the way, a lot of questions about how quickly, how many bureaucratic obstacles there are going to be. We're providing money to the Small Business Administration, which is the agency principally responsible for administering this program. My office is going to be all hands on deck. Anybody who needs assistance should call us. We're going to devote staff to helping you cut through the bureaucracy to the extent we can. The SBA has the mission of getting as much money out as quickly as possible. We want to keep some oversight and standards here so that money is just not shoveled at people who may not need or deserve it. But how to access it through the SBA, through the loan process there. I'm hopeful there'll be special forms and special access through online services. People don't have to physically go down to an SBA office, obviously. Someone asked a question, by the way, online. I just saw this message appear on my screen. Payroll assistance, that's through the SBA. And by the way, it's not only payroll assistance. The loans to you will assist in payroll. The unemployment compensation will assist with workers who are furloughed. The loans can be turned into grants. I mentioned this earlier, but let me just say it again. If payrolls are maintained, if you pay people, the loans can be forgiven. And I'm hopeful that we can get as much money out as quickly as possible. And again, my staff will be ready, willing, and able to help in any way that we can. We have very good relations with Connecticut SBA. We have very good SBA office in Connecticut, very responsive. We've worked with them on a vast variety of issues, especially veterans. And I'm hopeful we can continue.
And Senator, I'll just start reading through some of these questions that we're getting online here. I got one, this one came to me through text from Bill Villano with Workforce Alliance. There will be some businesses that with all these just changes in how people do work are not going to survive through this. Is there money in the bill for retraining? Even with our existing businesses, they're going to have to start doing business in different ways, just like we're on a webinar right now. Anything for retraining the workforce?
I believe there is in the appropriations part of this bill. Let me just say, I'm glad you raised this point. And I should have actually said it as maybe one of the first things. Number one, this bill is bipartisan. It's the third of our packages, and it is bipartisan. It wasn't when it started. I'm not going to go into the politics because I think we should try to keep on a high plane here and keep the discussion or the conversation very nonpartisan. But it is bipartisan now. And my view is that there will have to be another round, another package. The logistics are formidable because we all want to go home. We are in a potential infection cauldron here. We're all in the nation's capital. We're coming to vote later in the day. We've had meetings, we've been trying to make them telephone, but we need to have another round. And I think training assistants at all levels, we need more, we know in Connecticut that we need more skill training here for the defense industry, which by the way, will continue to receive money under its contracts. EB, Pratt, Sikorsky, all the supply chain will stay in business. In fact, I'm working as a member of the Armed Services Committee to raise the amount of defense spending. In other words, accelerate those contracts so that we can move from the unfunded priorities of the Navy, for example, a second submarine, to work this year and scale up those kinds of payrolls. But yes, training assistants, other ideas you have, please get them to me because we want to include them in the next round.
Some questions about independent contractors. Will they fall into these categories and be eligible?
Great question, and the answer is yes. We live in a gig economy. Independent contractors, self-employed, they're all covered. Now again, we're doing this. We're learning to ride the bicycle for the first time here. This has never been done before. Never been done before on this scale. TARP was less than half, about 800 billion. We're talking here about 2 trillion. So we're going to have to learn as we go along, but yes, they should be covered.
And Senator, just seeing the unemployment numbers that some businesses have been impacted for going on 3 weeks now, and so they've already had to let staff go. Can they rehire that staff back on and be eligible for the program? How does that timing work?
Yes, it does look back. It is reimbursable. That's another provision that we added. It wasn't originally in the bill. But my understanding is, I'm not sure how it's worded, but the concept is, yes, businesses who have laid off people already can hire them back, they get a loan, and then have the loan forgiven.
That's great. Yeah, because it is definitely a different economy and things have changed significantly. Can you talk a little bit more about the nonprofits that are eligible and how that would work for nonprofits?
Definitely, very important question. Nonprofits are small businesses. That's the way they're regarded. In other words, they may have laid off people. If they hire them back, they're covered again, and their loans are forgiven as well. Under 500 employees, which I think is most of the nonprofits on this call. We have, by the way, some controversy about the nonprofits bigger than 500 employees. For example, some of the national organizations that may have chapters in Connecticut, how are they going to be aided? We're trying to iron that issue out right now, but I think everybody on this call probably has fewer than 500 if you're a nonprofit.
There was a question about 501c6s, C3s. Is it all 501cs, or is that still narrow language there?
We tried to cover 501(c)(6)s. At the moment, the bill covers only 501c3s, which are your classic nonprofits, or 501c4s. It does not cover 501c6s, which unfortunately, I regret, includes the chambers of commerce. And we're working even as we speak to include it, but maybe that's one for for the next round. It does not cover 501c6s. Frankly, one of the concerns is that everybody can support chambers of commerce, but what about trade association? You know, the door would be wide open to a lot of associations and groups that we might not want to cover, and we need to narrow down how we're going to do it. But 501c3s, 501c4s, definitely.
Okay. As far as the SBA loans that people have already applied for, do you see that those applications would still stand, and this would just then add on top of it? I know that's a little bit detailed on how people actually apply, but any thoughts on that?
My presumption is that applications made already would still be good, but you should check on it just so that application is at the top of the pile, not sort of at the bottom. And again, that's an implementation issue. The SBA is going to have to make the decision about whether or not there have to be supplemental applications under this specific program. To be safe, get in touch with the SBA.
When is the earliest right now that you think a business could receive some of this cash? Cash flow is a big issue and big concern.
I've asked this question several times, and the best I can tell you is that the goal is that it be available within days. Within days. You know, part of the answer to that question will depend on how quickly applications are submitted, how complete they are, and then how strongly we advocate for them. And that's why I mentioned my office is going to be available. If we can be your advocates, as we've done on other kinds of government programs before, we want to be there for you. But you know, the goal is to do it as quickly as possible. In this case, payment delayed may be payment denied if a business goes broke, and we're talking about a bankruptcy situation, which you know, raises all kinds of complications if you're going through reorganization. I'm not sure how and whether the SBA can help.
And then, Senator, maybe if you could just talk about what you're seeing for unemployment. I know you mentioned that this is going to be a very different type of unemployment insurance that employees who don't get rehired back are going to be receiving than what has been in existence in the past.
The goal here is unemployment insurance on steroids. That's the way some of my colleagues have referred to it. Unemployment compensation has covered a portion of people's pay in the past. Our goal here is to revive the economy, to make sure that the economy demand is surged. I want to emphasize, because all of these questions have been about the economics, that even as we put cash in people's pockets, they are not going to be spending that cash if they're afraid to go to restaurants or malls or clothing stores or furniture stores. The revival of our economy depends on our healthcare recovery. But the goal here is near to full pay, as near as possible. It will depend on what the pay has been. And 4 months, we may need to extend that 4 months to an even longer period in the next round. And I noticed somebody in their text on the screen. I'm trying to read and talk at the same time. So I apologize if I seem somewhat distracted and I don't get to all the questions on the screen in front of me. What's the turnaround time for SBA approval? You know, we hope as soon as possible. SBA is going to be adding people to deal with these applications. There's going to be a major influx of them. We'll be pushing the SBA. We know time is of the essence.
Sarah, maybe you can just talk a little bit about, I'm sure you've been in briefings and that, what does the rest of the virus outbreak look like? Are the measures that in Connecticut we've put in place where we have shut down all non-essential activities? Can we expect to start to see that being having an impact on what occurs with the spread of the virus? What can you tell us about that?
I'll repeat what you probably heard and read. I'm no public health expert, but I think Governor Cuomo has been very eloquent and effective in describing what New York faces, which is a frightening potential harbinger of what Connecticut faces. And Governor Lamont, again, also has been very articulate and effective as a leader. I give him a lot of credit. I've been in touch with him almost daily. I spoke to him yesterday. And we're going to see a surge of cases. This is going to be bad, as the Surgeon General said. The U.S. Surgeon General said just within days, it's going to be bad. We're hoping it won't be, but we have to prepare for the worst. Prepare for the worst, hope for the best. And that means ventilators, masks, tests, ICU beds. The Yale Payne Whitney Gym, I saw photos of it. I talked to Peter Salve yesterday. I've been converted into a major hospital, just like the Javits Center in New York. We need to be prepared for a lot of people getting sick and a lot of people getting really sick and needing ventilators just to stay alive, particularly people who are older. But make no mistake, younger people are going to be really severely sick too. Children may not be as severely sick as often, but they're going to be very sick. So this is going to be challenging. That curve that we're trying to flatten, you've all seen those curves, trying to flatten it. But we're also potentially going to see a diminishing and then a resurge in the fall. So nobody be surprised. This challenge is going to be with us for a while. And glad to see you're with your family, Garrett. And very heartening. Wish I were with mine. And we want to keep everyone safe. And the point here is we need to be prepared for the worst, and that includes the economic crisis as well. You know, I can tell you, I may go home after we vote and the House votes on this package, but I'm going to stay at work in Connecticut. I will be available by telephone. I want to give everyone my personal cell phone number while we're on this call, 202-641-0532. 202-641-0532. You can text me. I welcome the texts. I welcome the calls. I'm going to be going to meetings. I consider some of those meetings essential. I'm not going to be meeting with groups. They're going to be mostly one-on-one, one-on-two or three, which I have been doing, for example, at the food banks, at some of the health centers in the state. Very limited groups. If I go out, it will be really to get a hands-on feel for what is happening on the ground. I want to know what's going on the ground. I want to know if your SBA application have been delayed, if there is too much turnaround time. I want to know if the hospitals are not getting the equipment. I want to see what's happening and hear what's happening. So I hope you'll get in touch with me. Somebody is asking for me to repeat the phone number. 202-641-0532. 202-641-0532. You can call my Hartford office as well. We welcome you to call the Hartford office. We're trying to make sure that all those calls are returned, even if you get a message when you call the first time. Let me know if they're not returned. I want to know if they're not returned. But please call the Hartford office. My staff has been incredible. Rich Keogh is the head of our Connecticut office. He's the chief of staff in Connecticut. Joe Rodriguez is in charge of our constituent outreach. You should let me know, you know, if you have trouble reaching anyone. And again, 202-641-0532. Let me just say, because I just saw a message about landlords, there'll be aid for people to pay their rent and mortgages. That's what we'd like to see happen. People stay current. For landlords, I'm not sure what the exact question was, but landlords are small businesses. So they should be in line for aid as well.
And Sarah, I see a question. We'll take a couple more questions and wrap it up. But I do see a question about if you make over $75,000, you get laid off. Does that mean that you don't get any money, or you just get a prorated portion of that salary?
You are eligible for unemployment compensation if you otherwise qualify. I'm not sure how all of the income limits are going to be done. We're gonna, I haven't, a lot of it is at the state level, as you know, state implementation. So the exact guidelines are literally being thought about. They're not even being written yet. But the idea is, if you're making $400,000, you're not going to get $400,000. If you're making $125,000, you're not going to get full pay. Probably not if you're $100,000. I don't know about $75,000. We live in a higher income area. So Connecticut may have a smaller proportion of people that are fully compensated at their full pay, because other parts of the country may have fewer high income earners, but the goal is to compensate as many people with full pay as possible. And I saw something appear on the screen from one of our participants about Governor Cuomo saying that the rate of hospitalization is slowing. That would be good news if it's true. We're all hoping that this program will succeed, and social distancing and staying at home will succeed. All the public health experts say self-containment, staying at home, not going to school, not going to work, washing hands, all this stuff you've been hearing, that's the stuff that works. We don't have a vaccine, no means of prevention. We don't have a cure, no means of effective treatment. So we're flying blind, and there still are not enough tests. You've heard me probably be very critical of the federal government. Again, I'm not being partisan here, but testing is key, because without testing, we're literally flying blind. It's like you running your business without knowing what your sales revenue is, or in fact, what products are selling better than others. I'm seeing a part of a question that says if your employees who have special health conditions, if they have to stay home, there is emergency medical leave and family and medical leave, which is covered in the previous packages.
Right.
If I haven't mentioned some programs, it doesn't mean they don't exist. For example, there's massive amounts of funding for research into vaccines and treatment covered in the previous packages. Very important, going to the CDC and the NIH for that kind of research, which ultimately will benefit Connecticut also, because we have major biomedical research ongoing through firms and companies, particularly in the New Haven area. I visited many of them, and they are likely to see investments in the work that they're doing if it affects coronavirus.
And Sarah, we've seen a lot of our businesses here convert their production lines to making supplies for ventilators. Maybe they already were a part of that work, but they're ramping up. Masks, saw a plastics company start making plastic face shields. Is that what you're seeing at the federal level, that business really is responding in this country to meet the need?
Very definitely. I've had a number of very promising offers from medium-sized businesses who make, frankly, defense-oriented equipment. We have a huge defense industry and a supply chain in Connecticut, lots of machine shops, and I've seen a spirit of giving back come forth. Frankly, and again, I'm not going to be partisan here, but I'd like to see the president use the Defense Production Act As you know, this is a Korean War law that enables the president to issue orders which enable companies like those who have made offers ranging from the big ones, GM and GE, to those machine shops that have contacted my office. We're trying to figure out, because there is no Defense Production Act czar or facilitator, we're grappling with what to do with those offers. And but I have seen that kind of offer, you know, everything from masks, the clothing manufacturers who have offered to make masks, the machine shops offering to make ventilators. It's been amazing and inspiring.
And I guess if we were kind of wrap up the package, we're really trying to pause a moment in time so that we can do the things that we need to do to stop the spread and make people as whole as possible. Is that a good way to put it?
We're trying to, you know, add engines to the airplane while we're flying it, you know, change the wheels while we're driving. I don't know what the analogy is, but very much trying to do lots of different things at the same time while the virus is spreading. You know, this virus has no respect for state borders. It's an equal opportunity killer. It doesn't make any difference whether you're a Republican or a Democrat. It doesn't make any difference how much money you make. The Prince of Wales, I read or heard this morning, now has been infected. As you know, entertainers, 2 members of Congress or more, a member of the Senate, and you know, the spread has been relentless, but we will get through it. I just, you know, going back to your question about the offers that we've received, I am amazed by how resolute and resilient the people of Connecticut are. I'm continually inspired by those police and firefighters and first responders, the healthcare workers. I mentioned them earlier, who are in the hospitals right now. They're doing their job. They're going home to their families. They are risking everything. Some of them are separating from their families because they don't want to infect them. I think the sense of shared sacrifice is amazing. It's what makes this country great. And at the beginning of World War II, you know, in 1940, President Roosevelt invoked the Defense Production Act. It was almost a year before Pearl Harbor, but he saw it coming. So he put the automobile manufacturers to work on making bombers because he knew the war would depend on air superiority, which eventually it was. There are lots of lessons of history here, but the overwhelming lesson for me has always been, we are great people. There's nothing that the United States of America cannot do if we come together. And the Senate has come together, not without some friction, not without some bumps in the road, but that's democracy, right? We have our disagreements, and at the end of the day, like a family, we come together. And so I really want to thank everybody who's on this call. Some of the questions have been flashing on my screen. I apologize that I haven't answered all of them. I'd like to see more coordination between the federal and the state governments, particularly on providing equipment and on manufacturing. I'm hoping this state and local aid will enable it, but we're going to try to work on that coordination as well.
Senator, thank you. We appreciate it. And obviously a lot of details that are going to be coming out. I mean, this bill is agreed to, but still is going to pass today, hopefully. And so as your office gets those details, you know, definitely use the chamber. We will get all of our staff up to speed on what's in it, because I know there's still a lot of questions out there, a lot of questions about if you've already laid employees off. Senator addressed many of those. We'll try to get as much of a summary out to everyone as possible, but appreciate everyone joining, and definitely, Senator, thank you for taking the time to do this.
Well, thank you very much. And again, get those questions to me. The chamber would be a great coordinating vehicle for it. I really, really appreciate the chamber's work. Thank you to you, Garrett. I know you worked hard to put this call together. I apologize for the delay, but you know, this is, I'd like to have another, frankly, for anyone who's interested in another teleconference, even if it's just a few people on the next call. I'm frustrated, frankly. I'm frustrated by the delay, but I'm also frustrated by the inability to get out personally, to meet with people, to visit you. You know, I get around the state a lot. I go back every weekend to Connecticut, partly to stay sane. I go home every weekend, and I've been frustrated by being down here, but I really hope that you will stay in touch with me, and we have another call just like this one, even if everyone can't join it. So thank you so much, Garrett, and we'll continue the fight. We're going to be fighting for you. Thank you.
Great. Thank you so much. And thank you to all those businesses out there. We know you're going through a lot. We'll continue to be an information source for you. Hope everyone has a great day. Please stay safe. Thanks.
Stay safe, everyone. Thank you.
Thanks, Senator.
Thank you. Take care.
You too.